and I am here at the annual meeting of the North American Menopause Society, and I am speaking with,
This is Dr. Jim Simon.
and you are,
I'm clinical professor of obstetrics and gynecology at the George Washington University School of Medicine in Washington, D.C., and the medical director of Women's Health and Research Consultants, an independent research facility also in Washington.
and Dr. Simon is also a past president of the North American Menopause Society. And I heard him give a talk yesterday morning, and he was talking about how to prevent your bones from breaking. In other words, prevention of osteoporosis. So I wonder, how would a woman know she might be at risk, or how does she keep her bones safe?
Well, first of all, there's no way to know if your bones are melting away underneath you unless you get some kind of testing. It's one of those silent disorders like high blood pressure that don't really give you a warning until there's something really bad. In the case of high blood pressure, it might be a stroke. In the case of low bone density or loss of bone, it might be a fracture, like even a hip fracture. But
So you don't really know anything's happening until some traumatic thing happens and you break a bone.
correct. It's a big problem.
And how, well, first of all, who might be at risk?
So the paradigm of the person at risk is a elderly Caucasian or Asian woman who's thin, has a sedentary lifestyle, and who might be a smoker or even historically a smoker, and who likes a good glass of wine or a hard drink more than one a day. That's a real high-risk person. But
And-
a person that might not even have any of those things, except maybe she's white or Asian, is someone who has a family history of osteoporosis, or who had no menstrual cycles when she was younger, or who has historically had a broken bone or two during their more youthful time in their lives.
So if this woman were to get to have some of this history, or maybe just a woman who has reached a certain point in life, how would she test to know if she is at particularly increased risk?
Well, this is actually quite straightforward. It's called a bone density test, or a DEXA scan. That's DEXA, or sometimes abbreviated DXA. It's a painless test of a very, very low dose of X-ray. And when I say a very low dose, a lot of people are scared because it's X-ray after all. But it's about as much X-ray as you get flying across country in an airplane. So it's a very, very low dose. And the results are extremely highly predictive of whether or not you need treatment and whether or not you have low bone density. And if you don't, you can put that scan in a drawer somewhere and redo it in 3 to 5 years and know if your bones are headed in the wrong direction. In other words, getting thinner and weaker and more likely to break.
And what age should that happen?
So there's a bit of controversy about this. Some of the societies have suggested getting your first bone density test at around 65. I think it's much better to get a good baseline test at around age 50, when the menopause changes are happening and when it's more likely to pick up someone at risk, to find out if you are that person with low bone density in whom we should make some choices. They could be lifestyle choices, or they could be pharmacologic choices to help you keep the bone you have because you already have lost some, or maybe you never had it to begin with, and we want you to hold on to what you've got.
Sounds like a song. So what happens in terms of treatment? Now, lifestyle things, might they be exercise or supplements? What would you suggest?
So lifestyle things that everyone should do, that is to say, women, men, everyone. And they include getting adequate calcium in your diet and adequate vitamin D in your diet, and those can come from dairy products or foods fortified with calcium or vitamin D, as well as weight-bearing exercise. Not all exercise is weight-bearing. Now, I'm a big proponent of exercise generally, and I'm a former swimmer, and swimming is great aerobic exercise, but it's not weight-bearing. It's good for your cardiovascular system, not so much for your bones.
So you want to get up and walk and do things.
Walk, jump, calisthenics, even bouncing on a hard floor has been shown to stress the bones enough to help them be maintained.
Mm-hmm. And in terms of medications, that's really a whole long discussion, so we won't do more than mention on it. But if lifestyle and so forth doesn't work, then there are medicines that people can take.
Yes, and the important issue here is there are medicines that you can take that prevent bone loss, even if you haven't lost a lot, but that may have other advantages for that particular woman, for example. So there are medications that can reduce one's risk of breast cancer by as much as 50% and prevent bone loss. This is an amazing thing. Whether you take it for breast cancer risk reduction or to prevent bone loss or both, doesn't matter because you can get a twofer regardless.
All good.
All good.
Awesome. Any other comments before we conclude?
Well, I would say the other thing is that there are a number of other medications that are approved by the FDA for preventing bone loss, and they too may have additional advantages for that patient depending upon who she is. That is additional above and beyond their ability to prevent bone loss.
So the most important thing is get checked.
Get a bone density test. Have a conversation with your practitioner about what the test means, not only for today, but for the next 3 to 5 years, and take some preventive action to make sure that that bone density test, if it indicates you need some help, stays strong.
Thank you very much.
My pleasure.